Welcome back to the INSTI HIV-1-HIV-2 Antibody Test Masterclass. In our previous module, we established a foundation in HIV pathophysiology and explored the immunological principles behind antibody testing. In this module, we will focus on the INSTI test itself, including its components, the innovative technology behind it, and how these elements work together to deliver accurate results in under a minute. Understanding the test components isn't just about knowing what's in the box. It's about understanding the precise engineering and chemistry that makes rapid, reliable HIV testing possible at the point of care. This knowledge will help you handle each component correctly, troubleshoot issues effectively, and maintain the highest standards of testing accuracy. Let's explore the INSTI test kit in detail. When you open an INSTI HIV-1-HIV-2 antibody test kit, you'll find everything needed to perform a complete test. Let's start with a complete inventory of what's included. Each single-use test kit contains one INSTI membrane unit in a sealed foil pouch, 3 solution bottles labeled 1, 2, and 3, 1 sterile single-use lancet, 1 capillary pipette for blood collection, 1 alcohol swab, and the instructions for use. Some kits may include a quick reference guide for point-of-care settings. Every component has been carefully designed and packaged to maintain sterility and optimal performance. The test kit should be stored at 2 to 30 degrees Celsius, which is 36 to 86 degrees Fahrenheit. The test should be performed at room temperature, ideally between 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit. Before we examine each component individually, it's important to understand that this is a closed system. Each kit is designed as a complete unit, and components from different lots should never be mixed. Always check the expiration date on the outer packaging before use. The heart of the INSTI test is the membrane unit. While it appears to be a simple plastic cartridge, it contains sophisticated filtration technology that makes the test possible. Let's explore its structure and function. The membrane unit contains 2 critical layers housed with a plastic cartridge. The top layer is a synthetic filtration membrane, where the test reactions occur. Beneath it is the absorbent pad that captures and absorbs all fluids, preventing leakage and exposure to potentially infectious materials. The filtration membrane has been treated with specific proteins at precise locations. At the top position, or the 12 o'clock position, is the control spot. This area is treated with protein A, which captures IgG and IgM antibodies, normally present in blood samples. At the bottom position, or the 6 o'clock position, is the test spot. This area contains recombinant HIV-1 and HIV-2 proteins, specifically GP41 from HIV-1 and GP36 from HIV-2. These are transmembrane glycoproteins that are highly specific to HIV. The choice of these specific antigens is important. GP41 and GP36 are envelope proteins that are highly conserved across different HIV strains, meaning that they remain relatively stable even as the virus mutates. This gives the test broad reactivity across different HIV subtypes. The use of recombinant proteins, synthetic versions produced in the laboratory rather than derived from live viruses, offers important advantages. There is no risk of infection from the test materials, and the proteins can be manufactured with high purity and consistency. This helps ensure reliable test performance from batch to batch. The filtration membrane's design is what enables the rapid flow-through technology. Unlike lateral flow tests that rely on capillary action to move a sample across a strip, the INSTI test uses a vertical flow-through membrane. When you add the blood sample and solutions to the sample well, gravity and the absorbent pad's wicking action draw the liquid through the filtration membrane. As the liquid passes through the membrane, any antibodies present can bind to the proteins fixed on the membrane surface. This vertical flow design offers several advantages. It's faster than the lateral flow, typically taking less than 30 seconds for complete absorption. It also provides more uniform distribution of the sample across the membrane surface, reducing the risk of uneven staining or false results. The membrane material itself has been selected for specific properties. Appropriate pore size to allow cellular components to pass through while retaining antibodies, chemical compatibility with the test solutions, and structural integrity to prevent tearing or deformation during use. Let's examine the control spot in more detail, because understanding how it works helps explain why it's a reliable indicator of test validity. The control spot has been treated with protein a bacteria protein with a unique property. It binds strongly to the Fc region of human IgG and IgM antibodies. This binding occurs regardless of what antigen the antibody is designed to recognize. All human blood contains IgG antibodies, which account for about 80% of all antibodies in circulation. As a result, any properly collected blood sample will contain IgG that can be captured at the control spot, making it an effective quality control mechanism. When solution 2, or the color developer, flows through the membrane, it contains both protein A and an indigo blue dye. The protein A binds to the antibodies captured at the control spot, and the blue dye attaches to this complex, creating the visible blue dot you see. If the control dot does not appear, it indicates a problem with the test process or sample. This may be due to insufficient blood collection, incorrect samples application while adding to the membrane, or, in rare cases, an issue with the sample itself, such as a sample from an individual who has very low antibodies levels, in rare cases including severe hypogammaglobulinemia. Now, let's examine the test spot, where HIV antibody detection occurs. This is where the test indicates whether antibodies to HIV-1 or HIV-2 are present. The test spot contains recombinant GP41 from HIV-1 and GP36 from HIV-2. As the blood sample passes through the membrane, any HIV antibodies present, they bind specifically to these viral proteins. This interaction is highly specific. Only these antibodies, which are generated in response to HIV infection, will bind to these proteins. The test doesn't distinguish between HIV-1 and HIV-2 antibodies. Both will cause a positive reaction at the test spot. This is an advantage in screening because it means the test can detect infection with either HIV-1 or HIV-2 without requiring separate test spots. When solution 2 flows through the membrane, the test spot develops in the same way as the control spot. If there is a visible blue dot, it indicates a reactive result, regardless of intensity. The intensity of this dot can vary depending on the concentration of antibodies in the sample, but any clearly visible dot indicates a reactive result. It's important to understand that the test spot only lights up if HIV antibodies are present. The recombinant proteins at this location do not capture normal IgG antibodies, only those specifically generated against HIV antigens. Now, Let's examine the three solutions that make the test work, starting with solution 1, the sample diluent. This clear solution in the red capped bottle plays a crucial role in preparing the blood sample for testing. Solution 1 contains 1.5 millimeters of a tris-glycine buffer solution with cell lysis reagents. This bottle is sized to accommodate the 50 microliter blood sample with enough room for proper mixing. The primary function of solution 1 is to lyse or break open the red blood cells. When whole blood is added to this solution, the cell membranes rupture, releasing the cellular contents. This is important because it allows antibodies that may be trapped within or between cells to be released into the solution where they can interact with the test membrane. The buffer system maintains the proper pH for optimal antibody binding. Antibodies are proteins, and their ability to bind to antigens is highly pH dependent. The tris-glycine buffer keeps the pH stable throughout the testing process. Solution 1 also contains 0.1% sodium azide as a preservative. This concentration is very small and poses minimal risk. It's important to handle all solutions carefully and avoid ingestion. The sodium azide prevents bacterial growth in the solution during storage. When blood is added to solution 1, it quickly turns red as the blood mixes with the solution. After capping and gently inverting the bottle several times, the mixture should have a uniform red appearance. This mixing step is important as inadequate mixing can lead to uneven distribution of antibodies in the sample. The diluted sample must be added to the membrane unit within 5 minutes of mixing. After this time, the sample may begin to clot or degrade, potentially affecting test performance. Solution 2, or the color developer, is where the test results become visible. This blue-colored solution in the blue cap bottle contains the reagents that create the blue dots you see on the membrane. The color developer contains several key ingredients: protein A, indigo blue dye, glycerol as a surfactant, sodium chloride for buffering, and sodium azide as a preservative. Let's take a closer look at how these work together. Protein A is a critical component of this solution. As we discussed earlier, it has high affinity for the Fc region of the IgG and IgM antibodies. When solution 2 flows through the membrane, this protein A binds to HIV antibodies that have been captured at the control spot, and, if present, at the test spot. The indigo blue dye is associated with the protein A complex. When protein A binds to the captured antibodies, the blue dye is carried with it, producing the visible blue color. The intensity of the color is generally proportional to the amount of antibody present, though even low antibody levels should produce a clearly visible dot. Before adding solution 2 to the membrane, it's crucial to invert the bottle slowly 2 to 3 times. The blue dye can settle during storage, and proper mixing ensures even distribution throughout the solution. The solution should be uniformly blue before opening the bottle. Solution 2 should flow completely through the membrane in approximately 20 seconds. During this time, the binding reaction is occurring. Protein A attaches to the captured antibodies and deposits the blue dye. This happens quickly because the antibodies have already been captured on the membrane surface during the first step. If you don't see the color develop immediately as solution 2 passes through, this could indicate slow flow times related to environmental conditions or sample characteristics. However, as long as the control dot appears after solution 3 is added, the test is valid. Solution 3, or the clarifying solution, is the final step in the test procedure. This clear solution in the clear cap bottle serves to clear residual background from the membrane, improving visibility, making the results easy to read. The clarifying solution contains a trisglycine buffer, detergent, and sodium azide as a preservative. Its primary function is to wash away excess dye and remove background staining from the membrane. After solution 2 has passed through, there may be residual blue dye on the membrane surface that hasn't bound to antibodies. This can create a background tint that makes the test and control dots harder to see. Solution 3 washes this away, leaving only blue dots that represent bound antibodies. The detergent in solution 3 is mild but effective at removing unbound dye. It's carefully formulated to clear the background without disrupting the antibody-antigen complexes that have formed at the control and test spots. After adding solution 3, the membrane should become noticeably clearer. The background lightens and the blue dots become more distinct and easier to interpret. This step is essential for accurate result reading. Results should be read immediately after solution 3 has completely absorbed and while the membrane is still wet. Reading the test within 5 minutes of adding solution 3 is critical. After this time, the membrane may dry out and background staining can reappear, making results harder to interpret. Now, let's look at the components used for blood collection: the alcohol swab, the lancet, and the capillary pipette. Each of these has been selected for safe and effective sample collection. The alcohol swab contains isopropyl alcohol for cleaning the puncture site. Proper skin cleansing removes surface contaminants that could interfere with the test or cause infection at the puncture site. The lancet is a single-use, spring-loaded device with a 0.8mm blade. The blade is fully enclosed before and after use, making it safe to handle. The spring mechanism ensures consistent puncture depth, which helps produce a sufficient blood sample for testing. The lancet has internal retraction mechanism that prevents reuse. Once activated, the device cannot be used again. This built-in safety feature helps prevent needle stick injuries and cross-contamination. The capillary pipette is one of the most important components for test accuracy. It's specifically designed to collect exactly 50 microliters of blood using capillary action. Let's learn how it works. The pipette has a narrow capillary tube that automatically draws blood to a marked fill line when the tip contacts the blood drop. There's an air vent hole on the side, which must remain uncovered during collection to allow air to escape as blood enters the pipette. The pipette should be held horizontally, slightly below the horizontal plane, with the tip touching the blood drop. The blood will automatically fill to the black line and stop. This automatic filling is critical. Do not squeeze the bulb while collecting the sample, as this can draw in the wrong volume. Once the sample is collected, squeeze the bulb to dispense the blood into solution 1. If the blood doesn't expel easily, hold the pipette vertically, lightly cover the vent hole with the finger, then squeeze the bulb. Remember, do not press the vent hole, and only lightly cover it with the finger. It's important to note that this capillary pipette is designed specifically for fingerstick blood collection. If you're testing venous blood, plasma or serum samples, or if you're using control samples, you must use a calibrated precision pipette capable of delivering exactly 50 microliters. The capillary pipette included in the kit should not be used for these sample types. Now that we've examined each component individually, let's understand why each one is essential and what happens if components are misused or substituted. The membrane unit cannot be substituted or reused. Each membrane is precisely manufactured with specific amounts of proteins at exact locations. Using an expired or damaged membrane can lead to invalid or inaccurate results. The three solutions work as a system. Solution 1 prepares the sample, Solution 2 develops the color, and Solution 3 clarifies the results. Skipping steps, using incorrect volumes, or mixing components from different lots can compromise the test. Correct use of the blood collection components is important to obtain the right sample volume. Too little blood can result in insufficient antibodies reaching the membrane, which can lead to a false negative or an invalid result, while too much blood can cause overflow and make results unreadable. This is why the INSTI HIV-1, HIV-2 Antibody Test comes as a complete kit. Each component has been validated to work with all the others. Using external materials or substituting components voids the test performance specifications. Proper storage and handling of the INSTI test components is crucial for maintaining test accuracy. Let's review the specific requirements. The complete test kit should be stored at 2 to 30 degrees Celsius. This relatively wide temperature range means the test can be refrigerated or stored at controlled room temperature. The test should not be frozen, as this can damage the membrane and solutions. If the kit has been refrigerated, allow it to come to room temperature for about 30 minutes before use. For optimal results, testing should be performed at room temperature between 15 to 30 degrees Celsius, or 59 to 86 degrees Fahrenheit. Each test kit has an expiration date printed on the outer packaging in a year, month, day format. The expiration date is determined by the component with the shortest shelf life, typically 15 months from the date of manufacture. Never use an expired kit, as accuracy cannot be guaranteed. The membrane unit foil pouch should remain sealed until immediately before use. Once opened, the membrane must be used right away. Exposure to air and humidity can affect the membrane's performance. Store kits away from direct sunlight and moisture. Even with the specified temperature range, prolonged exposure to high humidity or temperature fluctuations can degrade test components over time. If kits are exposed to temperature outside the recommended range, they should be returned to proper storage conditions and allowed to stabilize for at least 30 minutes. Running control samples can verify that the test is still performing correctly after a temperature excursion. One of the INSTI test's most remarkable feature is its speed, with results in under 1 minute. Let's understand the technology that makes this possible. Traditional laboratory HIV tests require multiple steps: sample processing, incubation periods, washing, and signal development, all of which take time. The INSTI test detects antibodies using a streamlined process that delivers results much more quickly. The key is the flow-through membrane technology. Instead of requiring separate incubation and washing steps, the INSTI test performs all these functions in a single continuous flow. As each solution passes through the membrane, it simultaneously performs binding reactions and washes away unbound material. The membrane's vertical flow design means gravity and capillary action drive the process. There's no need for pumps, timing devices, or multiple wash cycles. The absorbent pad underneath pulls the liquid through at the optimal rate for antibody binding to occur. The use of protein A as both the detection reagent and the control mechanism eliminates the need for multiple detection steps. Solution 2 reviews both the control and test spots simultaneously. This speed does not compromise its performance. Clinical studies have demonstrated that the INSTI test has a sensitivity and specificity of over 99%. These rapid results are possible because the necessary binding reactions occur quickly and efficiently on the membrane surface. To fully appreciate the INSTI technology, it's helpful to understand how it compares to other HIV testing methods. Laboratory-based EIA or ELISA tests are highly accurate but require batch processing and specialized equipment. Samples must be sent to a laboratory, processed in batches, and results typically take days to reach patients. Lateral flow rapid tests, which you may be familiar with from pregnancy or COVID-19 tests, use a different mechanism. The sample migrates horizontally across the test strip through capillary action. While these tests are also rapid, they generally take 15 to 20 minutes and can be more subject to user error in interpretation. The INSTI vertical flow-through design offers advantages in speed and simplicity. The membrane unit contains and absorbs all liquids. The sequential addition of 3 solutions provides multiple quality control opportunities. 4th generation tests detect both antibodies and the P24 antigen and can identify infections slightly earlier than antibody-only tests. Many require laboratory equipment and longer processing times. While some 4th generation tests are rapid, the benefit of P24 detection is limited to a short early window before seroconversion. For most testing situations, INSTI speed and point-of-care capability provide greater practical value. The reliability of the INSTI test depends on consistent, high-quality manufacturing. Let's understand the quality controls used to ensure each test performs as expected. bioLytical manufactures the INSTI HIV-1-HIV-2 Antibody Test under ISO 13485 Quality Management Standards and the Medical Device Single Audit Program, or MDSAP. These are the gold standards for medical device manufacturing, ensuring consistent quality and regulatory compliance. Every lot of membrane units undergoes 100% visual inspection during manufacturing. Trained quality control staff examine each membrane to confirm proper protein placement, membrane integrity, and overall appearance. The solutions are filled on automated lines equipped with vision systems that verify fill levels and cap placement. In addition, random samples from each batch are tested using control samples to verify performance meets specifications. Each lot of test kits is assigned a unique lot number, which allows traceability across the manufacturing process. If a quality issue arises, the affected lot can be identified and addressed without affecting other lots or production. This quality control extends to the blood collection components as well. Lancets are gamma sterilized and individually packaged. Capillary pipettes are tested to ensure they deliver the correct volume consistently. Understanding the components and technology is an essential preparation for performing the test. In the next module, we'll put this knowledge into practice with a complete step-by-step demonstration of the testing procedure. As you move forward, remember that each component serves a specific purpose. Proper technique with each component, from blood collection to solution handling, contributes to the test accuracy and reliability. Although the INSTI test is simple to perform, it relies on a defined set of technical components to achieve its intended performance. This includes the membrane filtration system, specific protein selection, and the 3 test solutions. Together, These components are engineered to support rapid point-of-care screening. You should now have a thorough understanding of the INSTI HIV-1, HIV-2 Antibody Test components and the innovative technology behind them. This knowledge forms the foundation for proper test performance. In Module 3, we'll walk through the complete testing procedure step by step. You'll see exactly how to collect a fingerstick blood sample, how to handle each solution, how to use the membrane unit, and how to read and interpret results. We'll also cover testing with venous blood, plasma, and serum samples. Understanding how each component functions will help make sure each step is performed correctly and helps with troubleshooting any issues. Although the technology is sophisticated, the procedure is straightforward when the underlying principles are understood. Thank you for your engagement in this module. I look forward to guiding you through the hands-on testing procedure in Module 3.